What if I told you you could know your risk of diabetes 10 years before it even starts? Not with expensive tests, not with complicated machines, but with a simple calculator that uses your daily life information. And here's the shocking part. Millions of people who will develop diabetes in the next decade have no idea today. By the end of this video, you'll learn what the Brazilian 10-year diabetes risk calculator is, how it predicts your future health, and most importantly, how to reduce your risk starting today. So stay with me. This could literally change your future. What is diabetes and why it matters? Let's start simple. Diabetes, especially type 2 diabetes, is a disease where your body cannot use insulin properly or doesn't make enough insulin. This leads to high blood sugar levels, and if untreated, it can cause heart disease, stroke, kidney failure, blindness, nerve damage. According to global data, many people are diagnosed late when damage has already started. That's why early prediction tools are so important. The big idea? Predicting diabetes before it starts. Doctors and researchers realize something powerful. Diabetes doesn't happen overnight. It develops slowly over years. So they asked, can we identify people at risk early, before disease starts? And the answer is yes. This is where risk calculators come in. What is the Brazilian 10-year diabetes risk calculator? Here's a much more extended, detailed, and easy-to-understand explanation you can directly use in your script. The Brazilian 10-year diabetes risk calculator is a tool designed to predict your chance of developing type 2 diabetes in the next 10 years. It uses age, weight BMI, lifestyle habits, family history, medical conditions, and gives you a percentage risk. Imagine if your body could give you a warning signal today about a disease you might develop 10 years later. That's exactly what the Brazilian 10-year diabetes risk calculator is designed to do. The Brazilian 10-year diabetes risk calculator, also known scientifically as Brazilian Diabetes Risk Score, is a scientific online tool that estimates your chances of developing type 2 diabetes within the next 10 years. It doesn't just say yes or no, it gives you a percentage risk, like 5% is low risk, 20% is moderate risk, 40% plus is high risk. So instead of guessing your future, it gives you a data-based prediction. Where did this calculator come from? This is not a random tool. It is based on real scientific research from a large Brazilian study called ELSA Brazil is Brazilian Longitudinal Study of Adult Health. Researchers followed thousands of people over years and studied who developed diabetes, who didn't, and why. Then they used this data to build a prediction model. The calculator is based on 7+ years of follow-up data from real people. How does it actually work? The calculator uses something called a risk prediction model. In simple words, it looks at your personal health information, compares it with thousands of people, and calculates your future risk. It analyzes multiple factors like your age, your body weight BMI, your blood sugar level, your lifestyle habits, your medical history, your social and health background. These factors are not just yes or no, they are used as continuous values, making the prediction more accurate. What makes this calculator special? Unlike older tools, this calculator has 27 different risk models, meaning it can work with only basic information, or include lab tests like fasting glucose, or combine both for better accuracy. This flexibility makes it more powerful and practical. What does it give you as output? At the end, the calculator gives a percentage probability. Example, you have a 15% chance of developing diabetes in 10 years. You have a 35% risk. This is called absolute risk, and this is much more useful than simply saying you have prediabetes. Instead, here is your exact future risk. Why is this important? Let's be honest, diabetes doesn't start suddenly. It develops slowly over 5 years, 10 years, sometimes even longer. So if you can identify risk early, you can stop it before it starts. How is it better than traditional methods? Traditional screening often uses only blood sugar level or just prediabetes label, but this has problems. Many people are labeled high risk unnecessarily. Others are missed. This calculator improves that by identifying fewer but more accurate high-risk individuals, showing actual probability instead of guesswork, helping doctors target the right patients. Studies show it can identify high-risk groups more efficiently than older methods. Let's take two people. Person A, slightly overweight and has normal fasting sugar. Risk maybe 10%. Person B, obese and has slightly high fasting sugar. Risk could jump to 30 to 60%. Even a small change in factors like BMI, blood sugar, can dramatically change risk. Is this only for Brazil? Good question. It is designed using Brazilian population data, so it works best for that population. But the concept is universal. Similar tools exist worldwide, like FinRisk at a risk score. However, each country may need its own version for accuracy. Who can use this calculator? This is the powerful part. It is not just for doctors. It can be used by general public, health workers, clinics, preventive health programs. It is available online and easy to use. This calculator is not a diagnosis, a replacement for lab tests. It is a warning system, a prevention tool, a future prediction guide. Think of it like a weather forecast. It doesn't say it will rain, but it tells you the chance of rain. And if chance is high, you carry an umbrella. Same here. If risk is high, you change your lifestyle. The Brazilian 10-year diabetes risk calculator is not just a tool. It is a window into your future health. And the most powerful part? You still have time to change that future. How does it work? These calculators use something called a risk model. They analyze data from thousands of people and identify patterns. For example, people with obesity has higher risk, people with family history has higher risk, sedentary lifestyle has higher risk. Then they combine these factors mathematically. Similar tools like Medscape Calculin use variables such as age, BMI, smoking, hypertension, steroid use, family history, and then calculate a probability score. Factors used in diabetes risk calculators. Let's break it down in simple language. 1. Age. Risk increases after 40. Higher age check higher risk. 2. Body weight. Overweight and obesity are major predictors. Fat around the abdomen is especially dangerous. 3. Family history. If parents or siblings have diabetes, your risk increases. 4. Smoking. Damages blood vessels. Increases insulin resistance. 5. Medications can raise blood sugar levels. 6. Blood pressure. Hypertension is closely linked with diabetes. 7. Physical activity. Lack of exercise increases risk. Each factor gets a weight. Each factor affects your risk differently. Older age has increases risk more. Higher BMI has strong effect. High blood sugar has very strong effect. Think of it like a scoring system. Some factors add more points. Some add less points. A mathematical model is applied. Behind the scenes, the calculator uses a statistical formula or risk equation. It combines all your inputs like this conceptually. Risk is equal to age, effect plus BMI effect plus sugar effect plus lifestyle factors. Then it converts this into a percentage. You get your final risk percent. Example, inputs. Age, 45. BMI, high. Family history, yes. Output, your 10-year diabetes. Risk is 32%. Important point. This is not a simple addition like 10 plus 20 plus 30. It uses a complex medical equation logistic regression model built from real patient data. What does your score mean? When you use a diabetes risk calculator, you get a percentage score. This number shows your chance of developing type 2 diabetes in the next 10 years. Low risk, usually below 10 to 15%. Your chances are small. Keep your healthy habits, just do regular checkups. Think, you're on the right track. Moderate risk, around 15 to 30%. Warning sign is: you may develop diabetes if nothing changes. What to do? Improve diet. Start regular. Exercise. Lose a little weight. Think, time to take action. High risk above 30 to 40%. Strong chance of developing diabetes. Needs serious lifestyle changes. What to do? Consult a doctor. Check blood sugar regularly. Make strict lifestyle improvements. Think, act now to prevent disease. Most diabetes risk tools categorize results like this. Example: some tools show 1 to 17% has low risk, 33% has high risk, 50% plus has very high risk. Why this calculator is important? Here's the truth. Many people with pre-diabetes don't even know it, and studies show when people see their risk score, they are more likely to take action and reduce their chances of developing diabetes. So this tool is not just for prediction, it's for prevention. How to lower your risk. This is where your future changes. 1. Healthy diet. Reduce sugar and refined carbs. Increase vegetables and fiber. 2. Exercise. 30 minutes daily. Walking is enough. 3. Weight loss. Even 5–10% weight loss reduces risk significantly. 4. Quit smoking. 5. Good sleep. Poor sleep increases insulin resistance. 6. Regular checkups. Blood sugar testing. Blood pressure monitoring. Limitations of the calculator. Let's be honest, it's not perfect. It predicts risk, not certainty. Different populations may have different accuracy. It cannot replace medical diagnosis. Actual diagnosis requires tests, like fasting glucose, HbA1c, OGTT. Who should use this tool? You should use it if you are over 30 to 40 years, overweight, have family history, sedentary lifestyle, concerned about your health. Future of preventive medicine. This is the future. Predict disease before it happens. Tools like diabetes risk calculators, heart risk scores, AI-based health prediction will transform healthcare from treatment to prevention. Here's something you need to remember. Diabetes is not always inevitable. In many cases, it is preventable. And tools like this give you a second chance. If you found this video helpful, like this video, share it with your family, subscribe for more health awareness content, and most importantly, take a moment today. Assess your risk. Start one small, healthy change. Because your future health depends on what you do today.